talking about our pharmacology series, and here we are going to discuss all the problems and difficulties students have while studying pharmacology. It's a very different subject but have a lot of memorization, so people tend to consider it's difficult. It's not difficult, it's just different. Here we're going to tell you all about the pharmacology and what are the different kind of stuff that you have to do while you have to study the pharmacology. So let's start. Our first topic is going to be general plan for autonomic nervous system. Autonomic nervous system controls all our reflexes. Nobody needs the introduction at this point. So I'm just going to be talking about all the points that are going to be helpful in your clinical vignettes and clinical scenarios. So let's start. Everybody knows that autonomic nervous system consists of two parts. First, one is the sympathetic nervous system, and the other is parasympathetic nervous system. As we know that sympathetic outflow is thoracolumbar from T1 to L2 and the parasympathetic outflow is craniosacral. It means that all the parasympathetic fibers are originating from the cranial nerves and from the sacral part of the spinal cord, whereas the sympathetic system are originating from thoracolumbar, for example T1 to L2. So this is all clear to everybody. Let's move to the next point. Every part of the autonomic nervous system consists of three parts. It has some origin in the CNS, a nuclei preferably, and then from there a preganglionic neuron originates from there, and it goes and it makes a synapse, and then it releases a neurotransmitter in that synapse, and that neurotransmitter goes into the postganglionic membrane, या postsynaptic membrane. From that membrane, it stimulates the postganglionic neuron and then it goes to the effector. So here we have discussed the preganglionic neuron, mostly it is an origin, then it makes a synapse in the ganglia, and then the neurotransmitter is released, and then the postganglionic neuron is stimulated, and then the effector. An effector is synapsed. It can be a neuromuscular junction, or it can also be a synapse, or it can also be a gland or a smooth muscle, anything. Let's move. What are the different types of receptors and transmitters in the parasympathetic nervous system? Let's talk about the preganglionic neuron. All the preganglionic neurons in parasympathetic nervous system are cholinergic, that is, they secrete acetylcholine in that synapse. So all the preganglionic neurons are cholinergic and they release acetylcholine. And the receptor that is present in that ganglion where they synapse is nicotinic N receptor, N for nerve. And then there is the postganglionic neuron. I should clarify this one thing, that every preganglionic neuron and every postsynaptic neuron in the parasympathetic nervous system is cholinergic. The neurotransmitter that is present into that system or that origin or that track or that fiber is acetylcholine. So you should keep it in mind. Let's move into the sympathetic nervous system. The preganglionic fibers in the sympathetic neurons are cholinergic fibers, and they make a synapse as the same way the parasympathetic neurons make the synapse, and they synapse into the sympathetic chain that is lying around the vertebral column, and then the postganglionic neuron is originating from there, and then they make a synapse at the effector level. So mostly the preganglionic neurons are cholinergic and postsynaptic ganglionic receptors are nicotinic N receptors, as we have studied into the uh, parasympathetic. They are the same. From this is and this one point and this second point is the same for both sympathetic and parasympathetic. The difference lies here. Postganglionic neurons are mostly adrenergic, that is, they secrete noradrenaline. The exception to this point is the apocrine sweat glands. The apocrine sweat glands is innervated with the cholinergic sympathetic fibers. This is the point you should always remember, that postganglionic neurons in all the sympathetic system secrete adrenaline, whereas the few exceptions to that cholinergic sympathetic fibers, that is the apocrine sweat glands, and adrenergic is equal to noradrenaline. There is also one theory that states that uh, the sacral part of the spinal cord outflow that we consider to be parasympathetic is basically a part of sympathetic outflow, but that is just a that is there are no researches to our to give that research any thought. So let's go to the next point. You should remember this thing. Now we have studied the neurotransmitters and everything into the sympathetic and parasympathetic system. So we should clarify our one concept, that all the preganglionic neurons in parasympathetic nervous system and sympathetic nervous system are cholinergic. I repeat this thing, that all the preganglionic neurons in parasympathetic system and sympathetic nervous system are cholinergic. That every ganglion that is related with the autonomic nervous system have neurotransmitter acetylcholine. What does that actually means? It means that if we're going to block the release of acetylcholine, it is going to block our every part of our autonomic nervous system. Now this is a very interesting scenario, that if we block the nicotinic N receptors, that if we block the nicotinic N receptor that is present into the parasympathetic ganglion and sympathetic ganglion, the same drug will block both of the ganglions, and our entire autonomic nervous system is going to wipe out. This type of drugs, for example, methylamine, were used to lower the blood pressure, but they were banned because they have a lot of adverse effect, because they wiped out all of the autonomic nervous system. So this is a point you should always remember, and there is no exception to this rule. Now let's, if there is a systematic diagram, this is the origin, this is the presynaptic sympathetic neurons originating from the, this is the origin. It is originating from the intermedial lateral nucleus of the thoracolumbar outflow. And there is the presynaptic neuron. There is the ganglion that is lying into the intervertebral chain, that is lying around the vertebral column. And then there is the postsympathetic neuron. And then there is norepinephrine that is secreted. This is the presynaptic parasympathetic neuron. This is the origin, that is mostly the sacral part of the spinal outflow, and the cranial nuclei, for example, the Dinger-Westphal nuclei. And there are the ganglia. This is the ganglia. The ganglia can be ciliary ganglion, Dinger-Westphal nucleus related cingulary ganglion, pterygopalatine ganglion, or it can be celiac ganglion, any part of the ganglion. This is the postsynaptic parasympathetic neuron. This part and this part, they are both cholinergic, and sympathetic, preganglionic, and postganglionic are always, first of all, presynaptic is cholinergic, and postsynaptic is ad adrenergic, with a few exceptions of apocrine sweat glands. Now we are going to talk about the different types of effects that are going to be produced with different types of drugs. For example, sympathomimetics that are going to use sympathetic nervous system, parasympathomimetics that is going to mimic the parasympathetic nervous neurons, and sympatholytic drugs that are going to mimic, that are going to stop the action of sympathetic system, and parasympatholytic drugs that are going to block the actions of parasympathetic nervous system. So these are very important emphasis points that are going to be discussing, that we will discuss in our upcoming sessions. But I want you to think about this one thing, that all the sympathomimetic drugs mimics the action of sympathetic nervous system, and all the sympatholytic drugs opposes the action of sympathetic nervous system, whereas all the parasympathomimetic drugs mimics the action, that all the parasympathomimetic drugs mimics the actions of parasympathetic nervous system, and parasympatholytic drugs opposes the action of sympathetic nervous system. It doesn't mean that the parasympatholytic drugs have the same effects as sympathomimetic drugs. This is true to some extent, but it is not always true. And this is something that you have to remember. When you are dealing with sympathomimetic drugs, your reference should be sympathetic system. And when you are dealing with sympatholytic drugs, the drugs that opposes the action of sympathetic system, your reference and your references of effects should be only and only sympathetic nervous. The basics of studying ANS. And now you can drop your comment and you can drop any query regarding any drug you want. You are having a problem in, and also you can study. You can give us your feedback about the video and anything you want covered. Just drop it in the comments, and I'll get back to you. I was not making videos just due to some reasons, and now I'm back and I'll be with you and I'll totally help you and we will always